Hi, everyone. Welcome. Good morning or good afternoon to today's webinar. I'm going to give a few seconds just for everyone to jump in. Thank you for joining today. Hi, everyone. Again, good morning or good afternoon. Welcome to the Health Literacy Solutions Center webinar series. Today's webinar, Rockford Ready 2022 Health Literacy Poetry Series. Before we get started, I would like to go over some quick housekeeping items. All attendees will be muted during the webinar. If you have questions for the speaker, please use the Q&A feature. It's either at the bottom of your screen or at the top of the screen. It's a Q&A symbol. Just go ahead and click on that icon and put your question in that chat box. Now, if you would like to make any comments, please use just a general chat function on the side to put your comments in there. Please note that the webinar will be recorded and posted in the Health Literacy Solutions Center webinar archives. Now, if you are requesting continuing education credits, a follow-up email will be sent after the webinar that will include the evaluation link, and that evaluation link will also include the CE request form. So you need to fill out the evaluation in order for you to receive continuing education credits. Next slide, please. Next slide. Just want to that one, sorry. So with that, I would like, it's a pleasure to introduce our speaker for today, Anquinette Parham. She's the Executive Director of Health and Human Services of the City of Rockford, Illinois. Anquinette Parham is an Illinois licensed attorney, experienced investigator, compliance leader, and the Executive Director of City of Rockford's Health and Human Services. The Health and Human Services Department provides services to individuals, families, and neighborhoods in Rockford, as well as in greater Winnebago and Boone counties. This is accomplished by addressing systemic, community, and individual factors. Key strategies include provision of direct services, partnering, collaborations, and advocacy. So with that, thank you, Anquinette, for being here today, and I turn it over to you.
All right. Thank you so much for having us here with you today. And thank you to everyone for joining and tuning in to learn about Rockford Ready. Actually, if you could go back one slide to our introduction, I'll just share a little information about Rockford Ready. So the City of Rockford's Health and Human Services Department, we are the community action agency for Winnebago and Boone County. And as such, we like to engage and work not only around poverty mitigation, but also around addressing the social determinants of health. So to that end, we applied for and received a grant from the U.S. Department of Health and Human Services, Office of Minority Health, around the proliferation of health literacy. So as a part of that grant, what we developed is this Rockford Ready initiative. And so Rockford Ready is indeed an initiative that's dedicated to improving the health of all of Rockford residents by providing health education and connecting residents to health resources, strengthening relationships between healthcare providers and residents. And our particular focus is really on African-American, Black and Hispanic or Latinx residents that live in some select zip codes in our community. And those zip codes were really identified based on the areas that were disproportionately impacted by COVID-19 infection. So we had those target zip codes identified, and our efforts really kind of focus there, but we're really serving all of our community because, again, we're dealing with individuals that live and work in the target zip codes. And then a number of the initiatives that we've been engaged in are actually citywide. But where we're measuring our impact is really in those target zip codes that were disproportionately impacted by COVID-19. This Rockford Ready partnership has aligned us, both our department, the City of Rockford Health and Human Services, with the University of Illinois at Chicago College of Medicine, their Office of Health Literacy, and the UIC College of Medicine that's here in Rockford, as well as a number of trusted community leaders. Rockford Ready really is an initiative that's been designed by the community and is for the community. We developed a health literacy task force, which includes all of these key partners that I just mentioned, and a number of other trusted organizations in our community. And if you'd like additional information, please check us out at rockfordready.org. You can see in the chat the website address for us, but essentially that is really what this initiative is, and our focus around health literacy and the work that we're doing is what really gave rise to this particular health literacy poetry series. Okay, you can go to the next slide and then the next slide, please. All right, so as you all know, October is Health Literacy Month, and the importance of this month is really just to help promote the importance of understandable health information. And so what we've done with Rockford Ready is just to be committed to producing easy to understand health information and services. So of course, this project really kind of came about as a result of the disproportionate impact of COVID-19. But what we recognize is that based on the health outcomes that we see here in Winnebago County, that health literacy, and there were actually some other prior studies that have been done in our community that really kind of reflected this low level health literacy and pointed to it as a critical area that we could put energy towards to help improve some of the health outcomes in our community. So some of the things that we've done at Rockford Ready have been to promote personal health literacy for residents here in our community. So in addition to that, we engaged in young residents to really join this conversation of health literacy. And the way that we did that was to develop this poetry series with our City of Rockford Youth Poet Laureate. And so this was a great way for us to really engage the voice of youth, and not only that, but diverse youth in these conversations about the importance of health literacy, what it is, what it entails, what it means, and why young people should actually be concerned about it. We also remind Illinois residents that they're not required to present identification or health insurance in order to get vaccinated against COVID-19. And that information was current as of this month. So that's not an extra requirement. So really helping people to understand and remove some of what may be perceived barriers around getting vaccinated or getting tested for COVID. So we also provided that information. We've also done a number of things to encourage residents to prepare questions ahead of their doctor's visits, and we've created resources for them to utilize. We even produced notepads that indicated, questions for your physician. We've engaged in social media and radio shows and internet radio shows and practices involving the community and really talking about these varying aspects of health literacy and what that means for individuals to be able to take control of their health and even to be able to engage in the necessary conversations with their providers, but how to go into your doctor's appointments or your provider's appointment being more prepared. So again, just encouraging them to prepare their questions and be ready and write them down and to feel empowered about communicating with their providers. We've encouraged residents who have limited English proficiency to ask for interpreters, that is their right to ask for interpretation in their native language. And so we've encouraged participants in our community to do that in order to increase the quality of the visits that they're having with their providers. Additionally, as part of this initiative, we provided COVID-19 vaccinations and boosters to residents. all throughout our community. We've engaged in a number of community-wide events and made sure that that vaccinations and boosters were made available, and we meet people in the community where they are. So again, going into our target zip codes and going to events where people already are, events that already have the draw of our target populations, and engaging with them there. Additionally, we've implemented strategic communications plans that have included, like I said, radio shows, internet radio shows, utilizing social media, as well as out-of-home ads. And then we recently actually have done direct mailers to the homes in our target zip codes as well. We also service organizations throughout this project. So we've created toolkits, both for individuals, organizations, and then specifically for healthcare providers as well. With our partners at the UIC College of Medicine, we have created and implemented health literacy and cultural competence trainings, as well as a training for HR professionals with regard to COVID mitigation. So we've really attempted a very broad reach in terms of how we engage with our community to really help us reach our overall goal of making Rockford ready. And by that, we mean ready to be healthy, ready to understand their health conditions, ready to increase their health literacy, and God forbid, but ready in the event that another pandemic happens, that we've increased health literacy so that folks know how to better process and understand information and take better control of their health to ultimately get better health outcomes. Next slide, please. So as you see in the headlines on this screen of Art Meets Health, art forms are being utilized in supporting and communicating contextually about health. And so we're seeing more and more that art is serving as a vehicle, both to address and to listen to communities that may feel disenfranchised. Americans may feel excluded in the dialogue concerning their own health. So health initiatives and programs are using art to meet populations where they are and to hear them more clearly. According to Creating Healthy Communities, Art and Public Health in America, the Art and Public Health in America initiative, the arts can be especially beneficial for public health in 5 key areas. And these include collective trauma, racism, mental health, social exclusion and isolation, and chronic disease. So research by the World Health Organization Regional Office for Europe has shown that the use of artistic media in healthcare and in communities can have a variety of benefits for health outcomes. They can be used to communicate valuable messages across cultures and political divides and help affected communities understand the risks of certain diseases or behaviors and provide ways for affected populations to process and to learn from their individual and collective experience to improve their well-being, among a number of other benefits. So again, these efforts of art meeting health, we're seeing both at a national scale here in this country, as well as through the World Health Organization. So this is something that definitely health educators and healthcare practitioners should pay more attention to in the ways that we can utilize the arts to really help engage the patients that we serve and the communities that we serve in improving their health literacy and taking control of their health outcomes. Next slide. Okay, we're going to share this poem called This Is Bad Enough by Elspeth Murray.
This is bad enough. This is bad enough, so please don't give me gobbledygook. Don't give me pages and dense pages, and this leaflet aims to explain. Don't give me really dodgy photocopying, and do not remove for reference only. Don't give me drafted in collaboration with the multidisciplinary stakeholder partnership consultation short life project working group. I mean, is this about you guys or me? This is hard enough, so please don't leave me oddly none the wiser or listening till my eyes are glazing over. Don't leave me wondering what on earth that was about, feeling like it's rude to ask or consenting to goodness knows what. Don't leave me lost in another language, adrift in bad translation. Don't leave me chucking it in the bin. Don't leave me leaving in the state I'm in. Don't leave me feeling even more clueless than I did before any of this happened. This is tough enough, so please make it relevant, understandable, or reasonably readable at least. Why not put in pictures or sketches or something to guide me through? I mean, how hard can it be for the people who are steeped in this stuff to keep it up to date? Do you know what I'd appreciate? A little time to take it in. A little time to show them at home. A little time to ask, what's that? A little time to talk on the phone. So give us the clarity right from the start, the contacts there at the end. Give us the info you know we need to know. Show us the facts, some figures, and don't forget our feelings, because this is bad and hard and tough enough. So please, speak like a human. Make it better, not worse.
So Elspeth's poem is entitled "This Is Bad Enough." So as you can see, that poem really underscores the importance of taking health literacy demands into account when you're communicating health information or interacting with patients in a healthcare setting. Our initiative really took inspiration from this poem as an opportunity to kind of share the perspectives of our residents with healthcare providers and healthcare organizations, and used it as a means to really help improve our efforts of working with them towards improving those individuals' personal health literacy. So really, that poem was an inspiration to the poems that you'll hear that we'll present shortly. And that poem really just kind of got us to thinking about what the opportunities were to hear from local voices on this same or similar topics, and how our community was interpreting these issues of health literacy, how they were interacting with their healthcare providers, what their perceptions were, what they were feeling when they were going to appointments. Again, you know, we could look on the front end at this data that was showing us that, you know, the health outcomes were poor, but there wasn't necessarily all of those anecdotal pieces really kind of filling in the picture and adding those pieces to the puzzle of why indeed health outcomes were so poor. So we looked to this piece of art as a piece of inspiration and helping us to move forward and say, all right, how do we engage our community and get their perspectives on this very topic and subject, and get their feedback. And so from that, we moved forward with this health literacy poetry series. Next slide, please. So again, that poem by Elspeth really inspired us and said, well, what can we do? How can we hear from our community? And as we were going through this project, the city of Rockford had named our Youth Poet Laureate recently. And so after engaging with this other poem, it made sense, you know, let's reach out to the new Youth Poet Laureate. Her name is Juliana Gamero. And Juliana is a senior at Auburn High School here in Rockford. And she was selected as the Youth Poet Laureate. And so she has a one-year term. And Juliana is just a young lady. She is an amazing young woman, and she's very passionate about her poetry, about this community, and about the impact that the arts can have, especially for young people. So she shared that she's always been surrounded by language, particularly Spanish and English, and growing up in a Mexican and Puerto Rican household deeply influenced her love of language. She's been published in the Young American Poetry Digest in both 2015 and 2016, and earned an honorable mention with the National Scholastic Art and Writing Award in 2017. She is currently working on her first novel. So it was really not difficult at all for us to have a desire to engage with Juliana as our Youth Poet Laureate and to just get her perspective and hear from her about this topic of health literacy and talk about that and allow her to express her art through it. So let's go to the next slide and we will share, we'll hear from Juliana herself.
Let's talk about the health literacy project. Tell me a little bit about how that came about.
So the health literacy project was presented to me by Rockford Ready. I heard about it when everyone from the Arts Council was, very nice and saying that I could be a person for it. I could be the poet that sort of puts together. And I think what really drew me into this project is the fact that I do come from a Spanish-speaking household and my parents are both immigrants. So the topic really does correlate with me, and I have my own experiences in the healthcare system, and I have been in the position of being a translator for my parents or trying to get them to say something or to advocate for themselves when it feels like things are really confusing.
And tell me a little bit more about Rockford Ready. What's that all about?
So Rockford Ready is an organization pretty much dedicated to helping individuals with health literacy and advocating for themselves in the healthcare system and be more confident in the healthcare system.
Oh, interesting. And you've experienced that yourself with your family. Tell me a little bit more about that.
So my father, he was born in Mexico, and his first language is Spanish. Even though he's been living in the United States for a very long time, my father still predominantly speaks Spanish. He also speaks English, but definitely is more comfortable with Spanish. And a lot of the healthcare providers here don't really speak Spanish. And I can often see his look of confusion when something doesn't make sense, or he'll ask my mom to help with translating, or he'll even ask me sometimes with certain things outside of the healthcare system. So I definitely feel like I have a really big tie to that desire to help, but also to help them help themselves.
One of the questions is, what does health literacy have to do with young people?
The thing about health literacy is that as much as we like to portray individuals afraid of asking, for help, specifically when it comes to health literacy, as older or stubborn in their ways or something like that, I feel like health literacy really does affect young people because in understanding it sooner, we get to know more as we grow, as we develop, and as we have to make more choices for ourselves. I think it's important to understand this before we get to that point.
What do you hope that your poems accomplish or encourage people to do?
I hope that my poems help people not be afraid to ask questions, because as someone who is kind of anxious, I definitely struggle with asking questions myself, and I know it can be hard, definitely can be, but at the end of the day, is it really worth the risk of something not going right? Is it really worth the risk of getting hurt, of being in danger? I don't think so.
And why do you, what would you say makes somebody's voice matter? Why do you listen to certain people and not others? Why does your voice matter?
I feel like my voice matters because we all have our perspectives in this world, and in sharing mine, I can give someone else insight into their own lives. I understand a lot of people my age, and even people older than me and people younger than me, we're all in a place of not knowing. There's a lot of unknowns in this world, and I think in listening to other people and taking insight from others, we're motivated to do more with our lives. And in getting to experience life, we have more insight to share with other people. just by living. So I think that's why my voice matters, because I know someone out there is in the same position as me, or someone out there doesn't know what to do.
With these poems, talk to me a little bit about the theme and why you wrote the way that you wrote it.
So I feel like a lot of my poems do incorporate metaphor and do incorporate a lot of emphasis on urgency. I feel like is a really important theme for me, specifically when it comes to this project. I wrote the poems the way I did simply because I was trying to accomplish that theme of self-advocating. I feel like that is by far one of the most important skills that we can learn in life. Just communication in general is an incredibly important thing, and self-advocacy is just one facet of that. So I think that focusing on that impact, focusing on that idea of you need to learn how to help yourself in order to prevent things. The overall nature of the healthcare system is intimidating, so we need to definitely find a way to surpass that.
So the themes and topics in my poems range from simply a conversation with your family to literal ER visits. My first poem is Jargon. Jargon is essentially about not understanding and the confusion that comes with not understanding. It is about, like I said, when you have to ask a question, two pieces in your mind are like not connecting, and that is an issue, and you have to address those issues head on. And oftentimes when people are explaining something to you that they're really well versed in, they don't make it easy for you to understand. And it's okay to not understand that. It's okay to be confused, but it's not okay to let that confusion continue.
Jargon. If I wanted strings of letters, I'd eat alphabet soup. Soup. But they gave me a diagnosis, a word that my Scrabble board won't count, that doesn't give me closure, it just gives me doubt. Don't leave me hanging on for more explanation. Say it all right here, right now, and don't spare my feelings. I know you know how to rip off a Band-Aid. Can you just do that? For me? For us? Say it up front how it is, and don't leave us hanging on for more, having to resort to articles online that make us think it's far worse or far better.
Breathe, Listen, Ask. That one is about talking with my father, essentially. And my worries when I have to leave to college and my father, who primarily speaks Spanish, has to learn how to advocate for himself. From a very young age, I had to help my father with translating certain things, not just in the healthcare system, but outside of it as well. And yeah, I pretty much just really want him to not have to depend on me when it comes to things like that. And it's definitely, I feel like it's a very shared experience, especially with immigrant children or children of immigrants. It is an important thing just to know how to advocate for yourself, and you really just need to breathe, listen, and ask. It's a hard thing to do, but that poem essentially is an encouragement to do so.
Hearts and chests and lungs and breathe. I tell him to breathe. There's a waver in his voice when he asks for rough translations. But I'm counting the days down until school resumes to capture me again, swooping his little girl from his home. I tell him to breathe. Listen. If I wasn't here, the puzzle would remain undone. If I wasn't here, how would he know? I tell him to breathe. Listen. Ask. Breathe. Listen, ask. I won't be here forever, holding your hand like you held mine. I know we want time to last forever. We want to keep it on a cycle. One blink of an eye and I'll fly. You'll be on your own. You need to breathe, listen, ask.
So as you can see, let's see, we can stop sharing now, I think. All right. Thank you. As you can see, yes, Juliana is just a phenomenal young woman, absolutely. And her words are so powerful and beautiful. So we are so excited to have been able to work with her and just been able to platform her even more through this process, and to really help to produce a very polished product with her work. So soon her full poetry series that she created as part of this initiative will be available on the IHA Solutions Center in the coming weeks. So we look forward to sharing that with you all. So please check back there for it. In addition to that, if you're interested in more about what we're doing here at Rockford Ready, please sign up for our newsletter at rockfordready.org. And we'll get that placed in the chat for you if you didn't see it. And please connect with us on Facebook. You can follow us on Facebook to see what we're doing, what we're up to, and the initiatives that we have going on in our community. But additionally, if you have additional questions, please put them in the Q&A so we can address it live as we move to our Q&A session of the presentation. So I know there was one question earlier that I can go ahead and address, which was how do we track the residents who get their COVID-19 vaccinations if they don't provide their identification? So one of the things that we're doing with this project in particular, we're not tracking individuals getting their COVID-19 vaccinations. What we're measuring is the difference in vaccination acceptance rates within our target geographic areas of the community. So we're not necessarily saying, did this individual get their vaccine? So it's not as necessary. What we're tracking, again, is the overall rate. So the rate of vaccine acceptance in the community. So we don't need to, all of our research that we've done has been anonymous. So the surveys that we completed were anonymous in that regard. And so we're not, we did get IRB approval for all the research that we've done. So we also did engage in some focus groups as well. But again, we're not tracking that individual vaccination acceptance of folks, but more so collective vaccination rates. So hopefully that answered your question. Any other questions, please feel free to share them in the chat and we will address them here live.
So we'll give everyone a second or so to ask a question. And if not, we'll go ahead and close the webinar up. So we'll just wait a bit.
All right.
There's a question that came in.
Okay.
How will you continue to work with poetry at Rockford Ready?
Okay, so in addition to Juliana's creation of these poems, we actually just participated a couple of weeks ago in a community-wide event that happens here in Rockford that's called Art Scene. And so what Art Scene does is it platforms artists and a variety of art forms throughout our community. So spaces that are, not traditionally an art space will open up and they'll serve as a venue and like gallery space or even performance spaces for that particular weekend. So we hosted an event in one of our target zip codes that was called Southside Scene. At that event, we featured Juliana, so she performed some of her pieces there. Then we also had a number of health resources that were present, and we also had some artists who were present as well. We actually had an artist who created a live painting based on the feedback that she got from participants about what health literacy meant to them. They talked with her about their interactions with healthcare and healthcare providers, and she created a beautiful piece as a result of that. And so if you, again, follow us on Facebook or sign up for our newsletter at rockfordready.org, you can see that piece as well. But again, we're open to just the impact of art meeting health. And so Juliana's term is going to be coming to an end here soon as our Youth Poet Laureate. But I really hope that that working with Rockford Ready has really kind of set her on a trajectory to keeping health literacy in her focus and really talking about the importance of it. As you can tell, it was such a very personal piece for her in terms of her experience as a young Latina. And we look forward to working with her even more and working with other poets. We've been open to that. So I think it's really been a great addition to what we've done and allowed ourselves to really lend space for voices of our target population to speak about what health literacy means to them, why it's important, and how they can engage both with us, with their providers, and with healthcare organizations as a whole around these topics. So we look forward to doing even more.
Awesome. We have another question that came in the chat from Michael. He says, I would love to learn about how one might be able to collaborate with you in your initiative.
Again, Michael, please visit our website. We do have a contact us form on the website, or you can like us on Facebook. You can reach out to us there as well. So those are ways that you can look to partner with us as we proceed in the future. But again, we're really excited about this relationship, about this partnership, and how we've been able to elevate the voices of the populations that we want to reach most with our messaging, that we've been able to elevate their voices through this effort. Additionally, at Southside Scene, we did use the National Academy of Medicine's Health Equity Traveling Gallery. They do have a traveling exhibit that entities are able to use. And so we had that on display at our event as well. And that was a very creative way to talk about health equity and again, to highlight the stories of people around the country how they engaged in issues of health literacy and what health equity meant to them. So again, just one more way to highlight this partnership between art and health and the importance of the two.
Great. Here we have, let's see, another question. How may we use art forms to connect with youth or otherwise disengaged population in our communities?
So I think one of the best ways, and what we did again, was reaching out to those groups where they are. So that includes, like we've gone to a number of neighborhood initiative events that happen throughout our community during the summer. We've gone to events where people are already gathering or congregating around those things that are important to them. And so however, the arts and poetry and music were infused into those events, that's how we look to collaborate. And we asked, we went in and we said, hey, this is what we're trying to do. This is the messaging that we want to convey. These are the conversations that we want to have with you, because what we know is that we cannot change the health outcomes in our community without the direct input of our community. And so additionally, I mentioned earlier, we developed a health literacy task force. And so a number of the ideas also came from our health literacy task force. Again, these key voices and key organizations in our community, as well as our community outreach workers that are part of the project, that have helped to really be boots on the ground and engaging with our community members. And again, these are folks that are entrenched in the community. And so different ways and opportunities to partner with those that are actively engaged in creative and performing arts around this topic. A number of those opportunities came about or were suggested even from our task force members. So again, we've engaged the community to have the conversation. We let them know that we were here for it, and we wanted to platform creative ways to engage these segments of our community that may not have wanted to be engaged. We met them where they were to engage in the conversation.
That's great, Anquinette. And last but not least, what impact do you hope this poetry series to have?
So again, I hope that that this poetry series again highlights the importance of diverse youth voices in this discussion around health literacy. I think for us, one of the things that I highlighted was just that it's really, you're never too young to start empowering or to start being empowered, and that as adults and service providers and healthcare providers and health educators, it's so important that we think about how we empower young people to speak up for themselves, how we empower young people to really experience self-actualization and acknowledge that they have a voice and that voice matters. It matters in school, it matters in the community, it matters in the doctor's office, that they should be able to speak up for themselves, and that it's important that they understand health literacy. And it's not something that you start picking up, once you reach middle age or you start having other health problems. That health literacy is something that actually can change the trajectory of your life. And it's important for young people to be engaged in that conversation and know how important it is for their own health. And I think too, just so many more conversations, just even around mental health and wholeness that are happening with people younger and younger. It's so important, again, that young people realize that they are empowered to speak up and advocate for themselves. And so I really hope that this poetry series just helps to highlight that and helps to highlight experiences that sometimes, healthcare providers may not think about from their perspective, but again, understand that young people will be their patients. They're their patients then, and maybe their patients in the future, and that they have to be empowered to speak up and that their experiences matter.
Awesome. Thank you so much, Anquinette. It was a pleasure to have you here. A comment here says very inspiring, and I agree. I second that. How art could play a role to better explain and understand public health messaging. It's just a very creative way to engage communities to understand their needs and experiences. So thank you very, very much for sharing your expertise and bits of pieces of the poetry that the youth poet created. So thank you so much for being here. Before we close out the webinar today, I would like to go over some just last minute housekeeping items. Just give me a second here. So thank you everyone for attending. You will receive an email, like I stated earlier, containing a link to a brief online evaluation. If you are requesting continuing education credits, you must submit that evaluation in order to receive your CE certificate. Please note that this recording and presentation slides will be made available at the Health Literacy Solutions Center, and it will also, the follow-up email will also include the link to that. And if you're interested in any of our upcoming webinars, you can also check them out at our Health Literacy Solutions Center. We update that constantly, so just keep an eye out for that. Thank you again, Anquinette.
Thank you so much for having me. And again, Juliana's in school right now, but being a great scholar. But again, it's been our pleasure to platform this brilliant young woman and her talent and just the beautiful way that she's helped us to carry this message to the next generation. So thank you for having us.